Today we will talk about dialysis, introduction of dialysis, types, dialysis process, physiological principles, types, indication, complications, and nursing care. So, what is dialysis? Dialysis is the procedure used to correct fluid and electrolyte imbalances and to remove waste products in renal failure. What dialysis can do and cannot do. It do waste removal and fluid removal. Do not correct the endocrine functions of the kidney. Hence, dialysis is not a cure for kidney failure. Now, the next is the dialysis types. There are two types: hemodialysis and peritoneal dialysis. Hemodialysis. Hemo means blood, dialysis means pass through. It removes nitrogenous waste products, excess fluid, and electrolytes from the blood by means of artificial kidney. Then comes peritoneal dialysis. It removes nitrogenous waste products, excess fluid, and electrolytes from blood by means of peritoneal membrane. How long does hemodialysis takes place? Hemodialysis usually is done 3 times a week. Each treatment lasts from 2 to 4 hours. During treatment, patient can read, write, sleep, talk, or watch TV. How dialysis occur? Blood flows to dialyzer, hemodialyzer, where filtering takes place, hemodialyzer machine, and then filtered blood is returned to the body. In this picture, you can see how dialyzers look like. Dialyzers are hollow fiber artificial kidneys that contain thousands of tiny tubules that act as a semi-permeable membranes. The blood flows through the tubules while a solution dialysate circulates around the tubules. The exchange of waste from the blood to the dialysate occurs through a semi-permeable membrane of the tubule. Direction of blood and dialysate flow in artificial kidney. The blood flows in one direction and the dialysate flows in the opposite. In this picture you can see countercurrent flow of dialysate and physiological principles of dialysis, osmosis, diffusion, and ultrafiltration. Diffusion is the movement of solutes from an area of greater concentration to an area of lower concentration. In renal failure, urea, creatinine, uric acid, and electrolytes move from the blood to the dialysate with the net effect of lowering the concentration in the blood. But WBCs, RBCs, and other contents within the blood are too large to diffuse across the membrane. Osmosis: the movement of fluid from an area of lesser to an area of greater concentration of solutes. Glucose is added to the dialysing solution and creates an osmotic gradient across the membrane to remove excess fluid from the blood. Ultrafiltration. Ultrafiltration is defined as water moving under high pressure to an area of lower pressure. This process is much more efficient at water removal than osmosis. Ultrafiltration is accomplished by applying negative pressure or a suctioning force to the dialysis vascular machine. Excess of hemodialysis. Access to the patient's vascular system must be established to allow blood to be removed, cleansed, and returned to the patient's vascular system. Several types of excess are available: fistula and graft. Fistula, a more permanent excess created surgically, usually in the forearm, by joining an artery to a vein either side to side or end to side. The arterial segment of fistula is used for arterial flow and the venous segment for reinfusion of the dialyzed blood. Graft: an arteriovenous graft can be created by subcutaneously inserting a biological, semi-biological, or synthetic graft material between an artery and vein. Indications: when the patient's vessels are not suitable for a fistula, grafts are usually placed in the forearm, upper arm, or upper thigh.